Thank you. So I think in the interest of time, we're going to turn it over to our first presenter, Angelica from the Arapahoe Council. I'm not going to get the acronym right. Safe Care Program. And I will let you talk more about your work and why it is important for people in this group to know about it. So I think you've got about 15 minutes, Angelica. And I can keep an eye on the chat for questions for you.
Perfect. Well, thank you, everyone. Let me make sure I'm going to share my screen. Please let me know if you can see it.
Looks good.
Okay, well, thank you for the opportunity. I'm very excited to be with all of you today and also to see Bonnie, which is also definitely one of our founders at ACCC. ACCC is known as our name is Arapahoe County Early Childhood Council. And I work for the Safe Care Program. I'm the Safe Care Program Coordinator. So the reason why we start with ACC is because ACCC has Safe Care is one of our home visitation programs as part of the family support. And along with, we have other programs as parents as teachers. We have a childcare navigator and also promoting safe and stable families. We, just going back a little more in terms of Safe Care, just a little history. We Safe Care started in 1979. It's an international program, but it was brought to Colorado in 2013. And so it's barely new for Colorado, but it's been for a long time and in terms of history and definitely showing evidence of how this program works and support families. We, in 2013, it was when it came to Colorado, it was part of our former governor, Hickenlooper, in terms of the plan of keeping kids safe and families healthy, 2.1. And the intent was to bring this program as a preventive service for high-risk families. And it's funded by the Office of Early Childhood and implemented in partnership with CAMP. The Camp Center. So some of you are already familiar with. A little overview about Safe Care is that this program is intended for families who have children under 5. It's a free volunteer program and it's very flexible, and I will talk a little more about the flexibility. It's a home visitation program. However, now with COVID-19, we have adjusted the program to visits that are virtual. We're doing it video and audio. Sometimes families may not have access to video, and that's where we kind of adjust the program. Definitely, we're looking forward to come back to do the in-home visits, to have that one-on-one interaction. But right now, we're being able to adjust the program this way, and so far it's been very is the only way that we can do right now, but it's definitely been helpful. The program is delivered with intent also for we work with primaries. They already have their skills. We strong believe that every parent wants the best for their children, and we are building upon their skills and try to support them to make sure that what other skills they can improve. Our main focus is focus on health, safety, and parenting. So if we think about other home visitation programs, they have probably different areas that they focus on. These are gonna be the ones that we work with. And the parents have, when I was talking about flexibility, it's because they can choose if they can take the 3 topics. They can choose one of them or 2 of them. And also the order is by the parents' decision. We rely on community partners, and this is what I'm very excited to be presenting today, because there's the only way that this program exists is because of our partnership with the community. Because our partners are the eyes and ears of our parents or caregivers, and that's how we are able to serve them. A little more in detail, Safe Care. This is an evidence-based module. It's very structured. We are trained by CAMP and NSTRC, which is our National Safe Care Institute in Georgia. We follow, we have meet fidelity. We, as providers who deliver Safe Care, we are certified parent support providers, and we have a very structured program. is designed for families at risk. And as I mentioned before, that was the intent with Work Colorado. It's a volunteer program. However, in other states is required. But we're very excited that Colorado has proven that sometimes families don't need to be required to take programs in order to improve themselves. So we're very happy to be one of the states that have this program still voluntarily. I mentioned all about we provide community resources. So when, besides our scope of work with these topics, is not only that, but we do connect families with other resources that they need. It's known also as one of the shortest programs in terms of home visitation. The families can complete the whole program in between 4 to 6 months, or before if they only choose one of the 2 topics. Our sessions typically are between 90 minutes average. However, with the virtual visits that we have seen a change on this. Some visits are shorter and some are longer, depending, because we see a lot of distractions. Keeping families virtual is definitely a challenge in terms of keeping them engaged. So that has been a change temporarily while we're doing visits virtually. So I'm just gonna go a little, just share this. For some of you might like data. And this is some of the evidence behind SafeCare and how this program has proved that there's benefits for children and families. And this is just a brief summary of some of what we've seen that is been successful. However, if you are interested in more detail about the results, we're right now, we're gonna be working on an evaluation of the program for the time that it's been in Colorado. But there is another pilot research report that is being released and is public at the Office of Early Childhood website. It's a big summary and also very in detail by counties. So one of the things that I want to share is that SafeCare is not, I will share a little more before this, but since it's a state program, it's delivered in 41 counties. I'm representing the Arapahoe County because I work for ACCC. And SafeCare, the organization who delivers SafeCare in Arapahoe County is ACCC. However, the metro sites that we also have the program are Savio and Family Tree. So depending where the family lives is where the organization is gonna deliver the program. The program is overall, if you want to know more detail about these counties and how this is gonna impact and the outcomes of the program, you can find that in this report in the Office of Early Childhood website. A little more in detail, because I know there's a brief time, but just share a little bit more how the program works. Families, when we help families in terms of safety, what we're looking to do is we target risk factors for environmental neglect and unintentional injury. So we're gonna help parents to reduce hazards. Definitely highlight the importance of supervision with the goal to reduce injuries. We want the children don't go necessarily go to the hospitals because there's accidents that are happening at home. We do, in terms of health, we are gonna be focused on primarily and how parents, when the child gets injured or ill, what is the best process and how they can prevent or identify and respond better to when this happens. So we're gonna follow the process, make sure that they recognize symptoms and they receive a health manual. We wanna make sure that they do have providers, the medical providers. So this is when we connect them with resources and make sure that the child is going to the doctor, what is that health provider, and if they don't have, we connect them with the resources to make sure that they have this. They receive some free health materials. We make sure they know how to take temperature, what fever means, and recognize some signs, and when it's important to go to emergency room, when you go to the doctor, or when to stay home, based on this manual that has been developed by pediatricians. In terms of parent-child interaction, depending on the age of the child, if it's under 18, they will see these skills that are definitely intended to promote positive interactions, bonding, attachment, and how they can use age-appropriate activities that will help stimulate their development. For children that are more than 18 months, we will promote how to increase those positive interactions, healthy development, prevent challenging behavior, and how they can use the skills like playing and maybe some challenges that they may having. We will work specifically in those challenges to make sure that this prevent misbehavior, and at the same time we want to reduce parental stress. This is part where when I was mentioning about the program delivered by county, Arapahoe County, we provide some incentives, but this is per site and organization where they have a plan or incentive. So what I'm sharing here are just some of them. Savio or Family Tree might have one, and it depends on funding and depends on the budget that we have every year, but also depends on our own community. We recognize that each community may have different challenges. So that's why each site will develop an incentive plan. And this is what we offer currently at the Arapahoe County Early Childhood Council. We do provide a gift card when the family complete one of the first topics. Currently, it's a $20 gift card for completing one, and 30 additional dollars gift card from completing the whole program. We do provide some items that are when they complete a topic that is tied to the topic that they complete. And we do also connect them with other resources, and sometimes we help them to get some items. We get donations. Sometimes we get coats, car seats, diapers. So we are able to connect them and provide those to them. And definitely connecting community resources that I mentioned before. So internally, since we have other home visitation programs, the families can also be connected with them, or we can reach out to our partners, and some of them, many like as you, I see Maribel Pasco. So when we see a need, we definitely will connect with these resources to make sure that they continue the journey. We recognize that sometimes parents have challenges with parenting, but besides that, there's other things that they need to make sure that they are able to have in order to be there and provide the best they can do for their children. Who is eligible, as I mentioned before, is any parent or caregiver who have a child 0 to 5. We do have to have a child in order to deliver the program, because we do practice with the children and we work in terms of safety depending on the age of the child is when we will child proof. So that's the main reason why we have to have a child in order to deliver the program. We, as I mentioned, we have 41 counties and 2 tribal, and definitely all the metro sites, all the metro areas are covered except for Douglas County. We are restricted to work with families who have an open court case with child welfare. That's the only restriction. We do receive referrals from DHA child welfare, but at the same time, the only restriction that we have is they cannot have an open court case. And families have to meet certain criteria. When we're talking about risk factors, it's just a list of characteristics that we know when they are present, at least 3 of them. There are definitely challenges that probably will guide to parents to have stress. And the goal is that their families don't get involved in the system. So that's where we focus on high risk families. So some examples can be a mix of somebody who has maybe a young parent, public assistance recipient on history of mental health. Another mix can be is a prior child welfare involvement. So those are domestic violence. So those are risk factors that we're looking, and the information about this, we normally, there's a list that we can provide if somebody is more interested in this. But if you have questions about this, we definitely, when you send a referral, we will reach out to you if we find that the family doesn't meet the criteria, and we will refer to another program that it might be a best fit. Then this is how we refer you if you have a family or someone that you feel like this family needs our support. Our community partners can refer online. The first link is our link directly to our online referral for the Arapahoe County Early Childhood Council, but also there is the statewide online referral, which is the second link. And this is basically the link that is displayed on our website at the Office of Early Childhood. For Arapahoe County, also you can submit a referral via fax. And we do, as I mentioned before, with Child Welfare, they submit referrals via Trails, which is their internal system. Families can also refer themselves online at the same link. And also we are in the PIC system. So when they are looking for benefits, we are also listed with one of the supports that they can receive when they are applying for benefits. And this is considered a self-referral, but it's also an opportunity for them where when they sign up via PIC, we can see that other resources that they're applying, and we can help them to connect as well. We do have some materials because I mentioned we rely on your support and our community partners that are connected with families on a daily basis sometimes. So we have some kits and materials to promote the program and help our partners to share our information with the clients. So if this is just an example of some of the things that we provide, we can drop off this and we can mail this information if you're interested and would like to share about the program in your community. So this is just a few of them. We have also videos that we can post on social media, and we can help also. We're doing a lot of newsletters content. So if somebody is interested in write an article about safety, we have done that, on interactions, tips about these topics that we feel very passionate about it. And then that's an opportunity to connect them with Safe Care. And I think that's all that I have for now. I just want to leave some time for questions. I'm not sure if there's any questions from anyone on the group about the program. No questions.
Angelica, can you just go over what CAMP is? I'm not familiar with what that acronym was.
Yes, so the Camp Center, Camp Center is our agency who basically trains. When I mentioned the program, the intent is a prevention child treatment. That's part of how it was brought to Colorado. The Camp Center is an agency definitely well known in this area. This is their expertise. So their house that they're building is at the Children's Hospital, and they do a lot of research, and that's where basically we work with Camp Center. They do a lot of research, and they do a lot of also child maltreatment, and they have providers focused on this. So the camp involvement has been substantial for us in terms of implementing. There are coaches, but they also being trained and coached by the NSTRC, which is the National Safe Care Institute. And they make sure that we follow the curriculum, and we do fidelity with them. And there is a big area, but their main scope of area is the focus on research and child maltreatment.
Thank you.
Yeah, it's a very good question. Thank you. Anyone has another question? Anything I can help support? I know when we're thinking about, I know recently Bonnie, she's very involved in our community. She constantly is helping us and connect with families that are on need. So we definitely, when anybody who is in the community and find a family that may need our support, you can always reach out to us, and we don't expect that you know all this. We definitely will make sure that we do our best to connect with this family and try to guide them and support them. And if it's not with us, we'll with somebody who we know that they can help them. But yeah, so my last slide is my contact information on our council website. If it's not for Safe Care, definitely we have other programs, as mentioned, Parents as Teachers, Childcare Navigation, and we are also where we have new programs coming up. And so I'm just appreciate the opportunity. I'm very thankful for being here with all of you and share about our program. So this is if you have further questions or you want to know more about the referral process or anything, please feel free to email me or contact me. And this is my phone number. So thank you, everyone. And I'll stay for the rest of the meeting. So if there's some more questions, please feel free to send them to me via chat as well.
Thank you so much, Angelica. That was a great overview. I think really helpful for me, at least. I'll speak for myself. If you want to go ahead and stop sharing your slides, we'll make sure to send out your slides and your contact information after the meeting. And I think we'll go ahead and move on to our next presenter, Chanel Reed from the Families Forward Resource Center. So Chanel, I don't know if you had slides you were going to share today, and you've got about 15 minutes to talk with us.
Everyone for the opportunity to come and share with you all about what Families Forward Resource Center, who we are and what we're up to. We are a full service family resource center, and it's just, I always love sharing our story. A lot of people don't know exactly what it is we do. So I love being able to have the opportunity to share what it is that we do and how we could be of a resource to you and your day-to-day lives in the community. Next slide, please. So who we are. We are a full-service community-based family resource center that was founded in 1995 on the Laurie campus over at the Community College of Aurora. We are one of 32 family resource centers under the network of the Family Resource Center Association. And that is a statewide association. And I'm going to pause here for a minute, and no, Rich, you can't answer this question because you know it, the answer to it. Does anyone know what a family resource center is?
Family resource centers, right, help families using a model of family empowerment to provide resources and also empower families to continue to seek resources on their own. Is that a little bit of it? I know you got a lot.
Yeah, that's the gist of it. Anybody else want to take a stab at what a family resource center is? Maribel?
I think I know we have talked about this. It's empowering families and giving them the right tools and incentives to be able to be self-sufficient. Yep. And it's a collaborative.
Yes. Yes, so both Rebecca and Maribel hit it on the head. We are, family resource centers are important because we do use an evidence-based, research-based model in moving families through a continuum to self-sustainability and reliance. We work with a lot of families utilizing the family development model and utilizing also the protective factors as well to move and kind of encourage families into that continuum of care towards sustainability. And we do that in a number of ways through goal setting, parenting classes. We also have early childhood education programs in the network. And we also kind of look at some workforce development opportunities and also some social enterprising opportunities to not only support families, but also to support the centers. So it's just more than a name. It's actually a collective body of centers that come together with the same purpose and vision in mind. So speaking of the 32 centers, most of them are in the rural and mountain areas. There are 4 centers here in the metro area. This is why Rich was disqualified, because he sits on the board of one of the 4 here in the metro area. So that's Aurora Community Connections, which is kind of up the road from us, right on North Aurora. Are you still on Colfax, Rich? Colfax and Florence? All right. And then we have focus points down in the Swansea Village area. And we also have the Center for African American Health in the Park Hill area. And those are the 4 resource centers, along with Families Forward, that are in the Denver metro area. As I stated, the rest are in the mountains and rural and Front Range areas. The mission of Families Forward Resource Center is to enrich entire families through partnerships and services that create a safe, healthy, and connected community. We're very family-centered in our approach to everything in all of our programs. And you'll see as we go through the presentation how really family-centered our programs are. Next slide, please. So some of our programs and services, well, all of our programs and services fall into these 4 buckets. Community health, which is where our Healthy Baby Strong Families program lies. It is our largest program here at the agency. And I'll talk a little bit more about that as the presentation goes on. But really, community health is our work around health disparities and addressing social determinants of health that really kind of disenfranchises our families into optimal care. And so we advocate for systems change. We advocate for legislatively for our families, as well as education, so that we can address these social determinants of health and provide the best outcomes for our families. We also have youth development programs, which also includes things like Kathy's Camp, which is our signature, one of our signature programs, and it was founded by our founder, Kathy Hill Young, when the center was founded. And it's a summer enrichment program for youth ages 5 to 14 years old. And we've been running that camp since 1995 when the center was founded. Unfortunately, we had to miss last year due to COVID. I think that was one of the only years that we missed Kathy's Camp. And we can talk a little bit more. I want to highlight Kathy's Camp further in the presentation. But one of the things that I'm most proud of with Kathy's Camp is that in 2019, we did win the Parents' Choice Award for summer enrichment programs in the state of Colorado through the Colorado Parent Magazine. So Kathy's Camp is pretty well known around these parts of Colorado. We also have early childhood education programs, and I'll talk a little bit about how we're building those in the center here as we go on in the program. And then also the third bucket is family development services. We actually do a lot of parenting classes. We also do a class called Parent Connect. We work a lot with child welfare, primarily in Denver and also just in surrounding areas as well. We do home visitation programs and try to, keep families united that may have some sort of court order or some other challenges that are going on. Our goal is to have some of our family advocates and case managers to work with those families to get them either reunited or keep them together and address those issues head on. We also do have a fatherhood initiative in our agency as well, where we uplift and build the fathers up and make sure that there's parental engagement and involvement on both sides. Oftentimes with our fathers, they're not always in the home. So we work with them on child custody issues and also help them to advocate and navigate through the systems of the court systems for visitation rights and also child support. We also uplift our men too through group sessions that focus in on their health and wellness as well. Right now, we're focused heavily on the mental health component for our fathers and also father engagement and partner engagement with supporting the young mothers that are in our Healthy Baby Strong Families program around lactation. And I know when we first brought the men into lactation, they were like, this is not for me. But we've been working with them, and we actually had 2 fathers to become go through the training to become certified lactation consultants. So just a little bit of education around something can go a long way and change a mindset. So our fathers are awesome. And then our fourth bucket is family advocacy. We advocate for our families to be strengthened. We advocate for our families to be resilient. We advocate for them to be self-reliant. One of the things that I always said when I came into the center is I don't want to see a repetitive cycle of generations coming through our center. So we make sure that we help them to we're not only advocating for them, but we also teach them to advocate for themselves. Advocacy on your behalf is way more important than what we can do for you. Next slide, please. So I want to talk a little bit about 3 programs that we have here that really has been keeping us busy in the last few years, as well as in the last 18 months. I mentioned the Healthy Baby Strong Families program in our community health bucket. And I just wanted to talk a little bit about what that program is. It is the National Healthy Start Initiative out of the Federal Health Resource Services Administration, which we're going to call HRSA because that's a mouthful. And we're getting ready to go into our 8th year of this particular program. We are the only national grantee in the state of Colorado that is a National Healthy Start grantee. And the program is for infants 0 to 17 months. And as part of the program, there are 2 really highlighted initiatives under the National Healthy Start Initiative. One is a fatherhood piece, and the other one is a community action network. So what is the National Healthy Start? Well, the goal of the National Healthy Start program is to reduce health disparities around maternal and child health issues. Our focus here at Families Forward Resource Center is to reduce the disparities among African American and Black families in the Aurora, Denver metro area. So we're really specific in honing in on making sure that we eliminate the disparities that are taking place in our community. Just to give you a little bit of data, because I'm a data geek, but I like to use data to tell a story. Right now, African American and Black babies are lost 3 times as likely as a non-Hispanic white family. So we have a very huge disparity. We're losing our babies for every 1,000 births, we're losing 3 times those babies. So it's been imperative that we do things that are preventable and also through education to ensure that our babies make it to their first birthdays. Yes, we want them to make it beyond, but we're finding that window of 0 to 12 months is the most crucial and critical window of an infant's life. So the National Healthy Start is all about babies and all about making sure that our babies are healthy, that our babies are loved, and they're coming into environments that are set up for their success. During the summer of 2020, we were able to partner with the Center for African American Health and CDPHE to address one of those high-risk factors in the African American community that kind of lends itself to some poor outcomes in an effort to change those outcomes. And so we really focused in on lactation and breastfeeding. And we had a grant from the ASTIO organization to really just hone in on lactation support for families, for mothers, and really encourage them to breastfeed as long as possible. We also wanted to get the father engagement part in that. And as I mentioned, we had 2 fathers to go through the program as well. But lactation is one of those social determinants of health that really is impacting our babies' lives, and being able to turn that to a positive has really, really been very rewarding. So now we have mothers who are breaking down those barriers and breastfeeding longer, and therefore our babies are becoming stronger. So we're really proud of that. Any questions? I want to stop and just ask if there's any questions now, or we can continue on and have questions later. But I want this to kind of be interactive, where if you think of something, I don't want you to forget it. So just come on and chime on in. All right, next slide, please.
Chanel, I have a question. Sorry, I was scrambling to find my unmute button. And apologies, there's a toddler running around.
Oh, that's okay.
In the background. So sorry, not sorry, actually. So Aurora Health Alliance likes to, as you know, share resources with the community, but the particular attendees of this meeting aren't necessarily the most diverse. So is there anything related to the initiatives with Healthy Babies that a less diverse group of attendees can know that we can bring back to our organizations?
Sure. So one of the things that probably would interest this particular group is getting involved with the Community Action Network. So the Community Action Network is our collective impact key stakeholder arm of this work that we do. It is the community voice. We have approximately 50 or so members that engage in our Community Action Network, and they come from all walks of life. They come from academic, they come from healthcare, they come from lived experience, because our families are part of the Community Action Network as well. They come from academic backgrounds. We have students that work in our Community Action Network. We have policy advocacy groups that work on the Community Action Network. Early childhood education organizations are part of the Community Action Network. So there's plenty of opportunity to participate in this work and bring your expertise to the table to help us to navigate through the various systems to create change in this particular area. So if anybody wants more information about the Community Action Network, I'm happy to provide that. I didn't put a slide with my contact information, but I can certainly put that in the chat.
That'd be great, thanks. And then Aurora Health Alliance is stepping into advocacy a little bit, so I'm sure there's plenty of crossover that we can explore together.
Yes, there are plenty of crossovers. I'll share with you, I probably will get the agenda, the current policy agenda, and I can share it with the policy group and you as well, and you all can see where there's some parallels to be considered in this upcoming legislative session.
Cool, thank you.
You're welcome. Any other questions? Okay, next slide.
Chanel, I had a quick question, which is, what's the best way to refer families to the Healthy Baby Strong Families program?
There's a couple of ways you can do that. You can either refer them through our website, and I can put that information in the chat as well, or you can just give us a call and or send us an email. We don't have a fancy protocol for referrals. If all I need is the referrals information, name, phone number, email, best way to contact them, and then I'll get that over to one of our family advocates to follow up, and they will follow up and do the actual intake. But I would say email and through our website is probably the best way to refer.
Chanel, I do have another question. I'm sorry. And like all the services that are offering, how is that working now with COVID-19? How many families come to the center, or how is that working for you during this pandemic?
So during COVID-19, we've moved all of our programs to virtual. So our group sessions take place in a virtual space, just like this Zoom. We also use BlueJean. The fathers like to use BlueJean for their platforms. So we did move all of our programming to a virtual space. When they do need to come to the center, we actually provided some basic needs services through drive-through service. So we do have a partnership that provides food through the food bank. We, as an agency, we run a diaper bank. So, and then all of our holiday programs, such as trunk and treat, our Thanksgiving giveaway baskets, and also our adoptive family. They were all done on a drive-through platform as well. So we've kind of adapted to COVID, so to speak. We are now starting to move into home visitation, back into the home visitation efforts, not necessarily with this particular program, not necessarily with the HRSA program, but for our supervised visits, because mostly all of our supervised visits are court ordered. And so the state has mandated that because they're court ordered, that we are encouraged to do those on a home visitation basis. So that is one piece that has been moved back into the in-person interaction, but mostly all of our programs are virtual.
Thank you.
Any other questions? Also,
now I have a question real quick, and I apologize if you mentioned this during the presentation, but can parents get involved with this when the person is pregnant and you guys start kind of the process then, or is this when the baby is born after birth?
So both. And then I'm going to add a third component. We also take prenatal. So we do prenatal, interconception, and postpartum.
Thank you.
You're welcome. I didn't mention that, by the way, but we do. So yeah, we're in the 3 phases of conception with this particular program, because a lot of things can be prevented in the prenatal piece. You know, if you go in knowing what to expect, then you will probably have a better outcome and a better experience when you actually do get into your interconception. And then postpartum, yeah. So, and also just to piggyback off Angelica, we are in the process of building telehealth into our agency as well. So we will be introducing telehealth options in our centers, probably starting, well, my goal is, you always have to have a goal. If you don't have a goal, then you're not going anywhere. But the goal is to start telehealth services in April. So we'll have that available to the community as well. Any other questions?
I do have one more question for you and Angelica, since you both presented, and that is, in this virtual world that we're living, are you seeing more parents participate or continue to stay engaged? I started a support group at Pasco, and I'm very surprised with the turnout that I've had and the engagement and how appreciative families are of our efforts to bring them together. So I'm just curious how that has impacted both of you guys' services.
Yeah, parent engagement is really, right now, it's almost like a cry, but they are really appreciative of being able to engage, even though it's in a virtual space. They still like the engagement. Social connection on any level, we're finding is really, really important, which is leading us to developing some other programs just to keep families socially connected to not only each other, but also to the work. So yeah, I would have to say that right now, any engagement is good engagement. And we're getting a lot of families wanting more engagement. And even my staff wants more engagement. That was something that came on very early on. They wanted more, they wanted to get together more often. And one day I just kind of chuckled with them. I said, you know, pre-COVID, I couldn't get you to come in the office. Now it's post-COVID, I can't keep you away from the office. But they just want to see each other, and they just, you know, just want to have that connection. So it is very important.
Yeah, I would like to, I definitely agree with Chanel. We noticed when the pandemic started, we kind of talking about safe care perspective. We have in that time like 54 families. We only have 7 families who disengage, who decide we don't want to continue the program because it's not in person. And that was the beginning. And we keep those families on hold, and we say, okay, when we go back in person, we will reach out to you and continue. and still we haven't been able to do it. But we learn also that when we have to adjust, some of them definitely appreciate. This has teach us that there are other challenges that we, through this module, are the only way that we can reach out these barriers, like the ones that are long distance driving, so weather sometimes, or when they have multiple children, it was very challenging sometimes. So this has provided us and more flexibility that we didn't used to have. So we have kind of embraced those challenges and get a good thing from that. So there's a lot of engagement. I agree with Chanel that at beginning was difficult. We were all learning how to do this and adapt. But at the end of the day, we have learned that other positive things have come from this module. And for some families, this works really well.
Mm-hmm.
Thank you both. And just a personal note, I've been on the other side. I started PASCA when my daughter was 6 months, but prior to that, I joined, and Bonnie, you'll like to hear this, Parents as Teachers, the program. And I mentioned this to Angelica, but I was so grateful to have another adult come into my home that I can have an adult conversation. And I think that as I continue to reflect on how we empower parents and continue to support moms with babies, I think it's supporting the parents, right? That's how we continue to support the babies and healthy communities. So I was very appreciative of that. And then I started working at PASCO, and your ED reached out to me for a meeting, and I wasn't sure if it was like personal or professional, but it made a big impact in my life. So thank you.
Any other questions? Okay, next slide, please. So Unite for Literacy is a program, well, is an organization, it's a for-profit organization that writes books for children of all ages, and those books are translated in many different languages. And I've had the privilege to be introduced to Mike McGore, who is the CEO of this particular company. I got introduced to him early last summer, and we just kind of were fascinated with each other's programs. And so we decided to just try a pilot program called our Growing Readers program. And we decided to do Growing Readers around our fatherhood initiative. And we thought about using it as a way, number one, to engage our fathers in daily reading activities with their children at home, which was one of the benchmarks in our HRSA grant for the National Healthy Start program. So we said, okay, well, we're meeting a benchmark here in our program, but we're also really, giving fathers the tools to be successful and giving them ways to get to engage their children at home. So the Growing Readers campaign, we started out with mailing 4 books a week for 8 weeks to 25 families who wanted to sign up for the program. So we just thought, okay, 25 families, we'll put it out there and see what happens. We ended up getting over 60 families registered for this particular program when we launched in November. So, but and we were really, really proud of it, but we also had to do a little bit of shifting. But the program in and of itself, like I said, it's encouraging daily reading in the home of children ages 0 to 5 years old. The focus is if we can get as many books in the home during this particular window of time, and then it'll get us closer to the 1,000 words of reading for students that need that's the benchmark for what they need to go into kindergarten. And so that whole program is focused on really getting those 1,000 words in with those children before they head off to school, as well as providing them resources in the home as far as books are concerned. So we continue to have this partnership with Unite for Literacy. We also have online books through Unite for Literacy on our website. There's a link on our website that you can click on and get books for free. And the other thing that I really like about Unite for Literacy is if parents are not skilled enough in themselves or don't feel comfortable in reading out loud to their children, there are books for parents that help to help them boost their skills and confidence in reading so that they can have that interaction with children. So it has turned out to be a really positive and igniting relationship between Families Forward Resource Center and Unite for Literacy. And I would just have to say the best is yet to come with this particular partnership. Next slide, please. As I had mentioned earlier in the presentations, Kathy's Camp Enrichment Program, again, it's for ages 5 to 14 years old. Right now, it is a summer enrichment program. However, prior to COVID, our management team had been talking about expanding this program to be year-round to also include school breaks, fall, winter, and spring breaks. Then COVID hit, so that kind of put a pause button on our efforts. But we are now back up, ready to go. We're planning our summer camp as we speak right now. And we're probably gonna roll into a year-round enrichment program for our kiddos 5 to 14 years old. But part of Kathy's Camp and what makes it so unique is it provides learning things around cultural awareness, exposure to the arts and sciences. We have a STEM program with Kathy's Camp. It also introduces our children to career possibilities and opportunities, as well as still providing that camp feel. They still get to have fun, but we also want them to be introduced to things that they're not necessarily introduced to in their daily life. So we want them to see what the possibilities of the world are and where they fit in that world. So that's why, you know, I get so jazzed about Kathy's Camp, because I remember coming up in a camp situation, and I remember being in camp. I was in 6th grade and I ran across an attorney and I was like, Ma, I'm going to be a lawyer when I grow up. Didn't make it because lawyers, when I was in college, everybody's going to law school. So the job possibilities looked a little bleak during that time, but for lawyers, but I still kind of stayed a little bit on that career path and ended up becoming a certified paralegal, as well as worked for a bunch of legislators for 20 years of my career before I decided to turn my hard work into heart work and come to the profit sector. So Kathy's Camp, again, we're getting ready to get geared up. Registration is actually going to launch probably in March, and the camp itself runs from June until July, and we'll have some exact dates here. Probably by mid-February, we'll have an informational meeting about Kathy's Camp. In 2019, we had a total of 185 campers. We're not going that big this year during in post-COVID. We're gonna max out at about 100 because of the social distancing, and we have to develop cohorts and things like that. So we're just, you know, everything has changed our world after COVID, but I'm still looking forward to the camp experience this summer.
Chanel, just want to let you know we've got about 3 minutes left. Do you think that would work?
I'm getting ready to wrap up. I'm sorry we had this discussion, but I like.
No, it was such a good discussion and we didn't want to cut it off. So you're good. Don't worry.
Last piece here, next slide, and this is the last piece, is our family development services and advocacy. As I mentioned earlier, we do offer parenting classes. We also do the supervised visitation and home visitation counseling services, as well as we have an extension of our fatherhood initiative, where we also have classes and counseling services for our fathers, specifically for our fathers. So I just wanted to make mention, we do this both from a court order perspective, as well as just families who feel as though they just need some intervention and they don't have to go through the court system to get that intervention. We run our parenting classes utilizing evidence-based curriculum under Nurturing Parenting. And it's about a 14-week program that we run. And we're getting ready to actually start up our next parenting class here in a couple of weeks. So just some of the services and how we all tie together to just be that family resource center that's needed here in the community. So that's the end of my presentation. If you have additional questions, please, feel free to share if we have time here, or, you know, you just reach out to me via email. I'll put my information in the chat and you can just contact me after, after this meeting. But thank you all again for listening to me and learning more about Families Forward Resource Center.
Thank you so much. That was great. And the discussion was fantastic as well.
I just have a quick question, if that's okay.
Yeah.
I just wanted to know for Kathy's camp and then the book program, is that also referring just by emailing you?
So the book program, well, actually both. You don't need to refer. There is a link on our website for the book program. And then the Kathy's Camp registration will also be on the website. It hasn't launched yet. It will launch in March. But if you wanted to just send someone over, because we are collecting a waiting list, you can email me that particular individual's information and we'll put them on our list. But everything will be on our website.
Thanks, Karen, for asking that. Great questions that I think we all want to know. So I'm going to go ahead and turn it over to Susan from Stride Community Health Center to talk with us about a little bit about Stride and the different services. Susan, while we're getting set up, I've noticed there's about 5 people who have joined the meeting since we did introductions. So if you want to go ahead and share in the chat your name, the community or organization you're representing today, and something we don't know about you by looking at you, you can go ahead and share that in the chat so we know who's here today. And Susan, whenever you're ready, I will go ahead and turn it over to you. It looks like you've got your slides all set up.
Awesome. Yeah, thanks guys. And looking forward to talking to you guys today a little bit. And it's been great to learn about the different organizations, and I'll add my name into the chat after. So I'm gonna try to not take up too much time, and then if people have questions, we can definitely answer those, and happy to talk through anything. So Stride is a community health center. Here we have 4 locations in Aurora and have 15 kind of in a U shape around Denver. And so kind of looking at who we are, as this will not, hang on, sorry, it's not advancing. There we go. Who we are as an organization. And so we've been operating for 32 years now. And looking at how do we really serve everyone in our community, and looking at primary care, behavioral health, pharmacy services. And so looking at being a health center that really is here to serve everyone. And so wanting to do so in a culturally sensitive way, and looking at how do we partner with people, how do we truly empower people to take charge of their health, and how do we support them on that journey so that they can lead healthy lives. So what we are working on providing is primary care, behavioral health, oral health, pharmacy, and care coordination. And so we service the whole spectrum. So we do peds, newborns, all the way up. We actually do have a geriatric specialist on staff as well. So we are able to take care of the entire family. And that is our goal, is that people can go ahead and stay with us the entire time. And then we do work to coordinate services as needed, if it's transportation or interpretation and health education as well at our clinic sites. And so the map, it might be a little hard to see, but there are kind of little icons over where our sites are, and most of them are on this map that we have here. And so looking at who we're serving, so we do serve 51,000 patients. This data is from 2019, and you can see from our payer mix that we really are focused on serving everyone. So predominantly Medicaid and CHIP, and then 38% of our patients are uninsured. And so the vast majority of those are undocumented, and really wanting to say, how do we improve access to care? So we do have 112 languages spoken. So we do have use Sericom language service line so that we can meet those needs of those patients. And then we do try to have bilingual staff as we can. In the clinics and working front desks and trying to really serve our community as best we can. And so we do see a fair number of children. Almost 30% of our patients are kids. And so looking at how do we really serve moms and babies and dads and the whole family, and grandma too. So looking at that. So we are here for your referrals. And so really wanting to serve the community. And the easiest way to do that is for people to call us at our community care services. And so we have our customer care line, and it's a one number, and so it's a call center that then services all of the sites for booking of the appointments. So it's kind of a one-stop shop. What makes it a little bit easier for patients is that you can just call one number, and then regardless of the site, they'll help get you connected with where you need to go for our services. And so we are doing COVID-19 testing and vaccines, which I'll get into in a second. And then we do have telehealth services. We know we can't do telehealth for everything, but we do have that available right now, and are working with patients to do that, to make sure it's sort of safe and what they need when we can. So we have been doing COVID-19 testing since March in 4 different counties. We've done over 39,000 tests, and we do test children as well. And so we are continuing our testing efforts as we are also providing the vaccine. And so right now we're doing events in the community. We're really limited, like everyone is, by the amount of vaccines we're getting from the state. We'd love to be able to do more events and vaccinate more people, but we are limited. We just did a vaccine event over at Overland High School and vaccinated a little over 500 people this past weekend. It was a drive-through event. It went really well. And the way to get registered is through our website, is to go online and register. Right now we're focused on the 70 and over group. And then, you know, with the governor's directive on February 8th, we will start moving down to that 65 and the other groups as well. And so just really trying to work with community, make sure we're getting our patients vaccinated, make sure that we're out there educating, partnering with community organizations, really recognizing that there is a disparity in who is getting vaccinated and how do we contribute to addressing that problem, and recognizing that we do need to reach our patients. And so we are doing in-reach to our patients through phone calls and emails and social media, and working with them when they come in for their appointments. We aren't offering the vaccine currently at our clinics because of the logistic problems around that. It is, unfortunately, it'd be a lot easier if this were like the flu shot, where we could just administer it in our clinics. But the reality is as soon as you draw it from a vial, after you've de-thawed it, you have 5 hours. And so we do have to kind of have these separate events for now, as we're trying to get as many people vaccinated as possible. And so that's a lot of what we're doing right now. We are involved in advocacy efforts. That's a good chunk of what I do, is reaching out to the community and also reaching out to elected officials. And so trying to figure out how do we better serve our families, serve our communities, look at what services kids are needing, you know, really support the safety net and think through how are we reaching all of those folks. And so I went through that a little quickly, but I am happy to answer questions or anything that you guys might have or want to discuss. So I will pause there, and I haven't looked at the chat. I'm sorry if anything has come through.
I have a question about the 70+ population and the vaccine. Mm-hmm. I'm curious if you guys have something in place for people that aren't already registered as a patient, but don't have access to a computer. Do they just call the main number, or how would that?
We have a different phone number to call. And let me be clear, we're vaccinating people who aren't just our patients. Our outreach efforts are focused on our patients right now. We're also focused on the community, but anyone in the general community. It's not just for our patients. Sorry if that was unclear. But we are definitely doing that. And let me get that number for you. It is, and I should have put it on the slide, I apologize. As I'm trying to pull it up really quickly on my phone, because that's the easiest way for me to grab it, except now it's frozen. So yes, so that number here is 720-362-4000. And that is a separate call center or a separate phone number specifically for vaccines and to get people registered. So I'll put that in the chat here in just a second, but that number is 720-362-4000. And thank you. Yes, Bonnie, we do have mobile vans that go out. We are Oh, thank you. Sorry.
And then just one more question about that, because I know the supply is super limited. Are they put on a wait list, or do they have to keep calling every day to check, or how is that? Okay.
Yeah, they are put on a wait list, and then we're working our way through the wait list. So essentially what happens is either you call the 721 number or you sign up online and you're put on a list, and our call center staff and our care coordinators will call you back to schedule a location and a date. And then at one of our events, and then essentially we've been doing mainly the Moderna vaccine. And so then essentially 4 weeks later, you come back to the same location at the same time for your second shot. So we are kind of booking those first and second shots at the same time. So once you get your first one, come back 4 weeks later on X date at X time. The last one we did was a drive-through event, and that went really well. It was really nice since people did not have to get out of their cars to get the shot. So, you know, which is a challenge for a number of folks if they're have mobility issues or on oxygen. So we are doing the best we can. We want to do more. We're just really limited right now on what we're getting from the state. So that's kind of where we're at right now. We're doing the best we can. It's not a smooth process. And I know it's kind of been in general, it's been frustrating for a lot of people. But, you know, go ahead and call, go ahead and sign up. And we are working our way through that list. So we're trying. What other questions? Do we have?
Susan, do you know if all the clinics are accepting new patients right now, or is it only certain locations?
I believe all of the clinics are accepting new patients. Sometimes a provider may have their panel full, but all of the sites are accepting new patients right now. And we do have a few, like our school-based health centers, that are closed right now because of COVID. So we have about 11 sites that are open, but they can help direct you to the closest site. So that is a challenge that we're working through, but we have managed to maintain providing services while doing testing, and also maintaining our staffing levels as well, which has been great. So. Are there any other questions? Awesome. I think, let me know. Here's my contact information. Please reach out with anything, or if you run into any problems or want to talk about anything, I am definitely here for you guys. So just let me know.
Susan, thank you so much for all of the information and the presentation today. Also sending the slide deck. So as I'd mentioned earlier in the chat, this group and all AHA work group kids members should expect to receive a follow-up email that will include all 3 slide presentations today as you marinate on this information that you've learned from everyone and think about potential ways to collaborate with the work that you're doing and in your own agencies. Their contact information will be available. So please join me in giving a shout out to all 3 presenters today. A lot of great information. Really enjoyed the discussion and the sparked engagement of good questions. So nice work, team. As we
actually have a question for Bonnie. Bonnie mentioned in the chat that that you're working with a nonprofit in Greenwood Village who helps people find a motel if they need one. Are you able to share who that group is?
Yeah, it's called HAT Force, Homelessness Action Awareness Task Force. Very small nonprofit based in Englewood, and frankly, we have more referrals than we can handle. But we've gotten CARES Act money, and right now we're using CDBG money from Arapahoe County. And we have about 24 families, about 60 people sheltered, and half of those are children. So we've been doing this since September, and we'll keep going. I mean, you can refer families to me, but at this point, we're pretty much at capacity. If someone leaves, we fill the slot. But yeah.
Thank you.
Yeah.
Well, again, thank you everyone for participating today and being engaged. Thank you to our presenters for joining us and sharing about the important work that you continue to do. We look forward to looking through the responses of the survey and appreciate your engagement in helping us plan what the remaining time together in 2021 will look like. And enjoy the 5 minutes back to complete the survey and take a quick bio break before we move on to other things. So everybody have a great week. Thank you.